Your Royal Highness, Minister, ladies and gentlemen, dear friends and colleagues, I'm very happy to welcome so many participants to our 26th Alzheimer Europe Conference in Copenhagen. It will be the last time that I have the honor of doing so as a chairperson of Alzheimer Europe, as I handed over earlier today this role to my colleague and friend, Eva Hojmarova from the Czech Republic. It is with a degree of pride, I must admit, that I look back at my past 6 years as chairperson of Alzheimer Europe. And our annual conference over the next 2 days will be an opportunity to highlight and showcase some of the achievements of our European collaboration. We have made tremendous progress in the past 6 years or in the past years when it comes to the recognition of dementia as a national and a European priority. We just heard from Sophie Løhde, the Danish Minister of Health for Health and Elderly, about Denmark's new dementia strategy. And it's encouraging to see how many European countries have now put in place such strategies. And I'm really pleased to hear the amount of money you want to put in, but it's not only the money, it's really the things that you do with the money, and I think that's important. More and more countries also recognize that the dementia challenge cannot be addressed by one country in isolation, but that we need greater and better collaboration between countries. And your experience traveling around showed what experience you can get and what ideas you can bring home to their own countries. Tomorrow we will have a roundtable discussion and you will hear from representatives of the European Parliament, the European Commission, the Luxembourg Presidency of the European Union, the World Health Organization, the World Dementia Council, and the Joint Programme for Neurodegenerative Diseases Research on how they are addressing dementia as a European and global challenge. I think this worldwide idea of putting all these together really shows how important we see that. On Wednesday, you will also hear from the Scottish Government on how it's coordinating the second European Joint Action on Dementia to identify good practices in the field of timely diagnosis, post-diagnostic support, care coordination, residential care, and dementia-friendly communities. I'm delighted to see the recognition of dementia as a policy priority and proud that Alzheimer Europe is fully involved in all these policy discussions. Our organization as Alzheimer Europe has also become a trusted partner in a number of key research projects, which are coordinated at a European level and funded by Horizon 2020, the European Research Programme, or by the Innovative Medicine Initiative, IMI. Alzheimer Europe ensures that the views of people with dementia and carers are represented in these research projects, takes part in the important discussions of ethical issues raised by dementia research, and ensures that the progress and finding of these important projects are disseminated to the wider community and the general public. Over the next 2 days, I look forward in particular to hearing more about our projects EPAD, which is the European Prevention on Alzheimer's Dementia, or MUPID, which is a model of patient engagement in Alzheimer's disease. That are the new projects we are engaged in, or EPAD is for a longer time now with us. Finally, I would like to highlight the development of human rights-based approaches to dementia and the growing recognition of dementia as disability. Our first plenary tomorrow will be dedicated to discussing the right-based approach, and I'm proud that Alzheimer Europe has been a pioneer in this movement. Our European Working Group of People with Dementia has been actively supporting our projects and activities over the past 4 years. It was initiated in 2012. During this conference, you will have the opportunity to listen to them as well as other people with dementia as plenary speakers and participants in parallel sessions. Tomorrow, a lunchtime symposium will be organized where the members of the European Working Group will share their experience of living with dementia. You are all invited to go there. I hope that you will share my opinion as well, but also my optimism. After looking back at the past 6 years, we have come a long way with unprecedented attention being paid to dementia by policymakers, increased collaboration on dementia research, and a true recognition of people with dementia as full partners of our movement. I look forward to the discussions, presentations over the next 2 days, and wish you all a very successful conference.